Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. We've come a long way talking about databases and electronic health records, electronic prescribing, and clinical decision support. And one thing I wanted to really focus in on is the intersection between medication safety and pharmacy informatics. Now, both of these topics are areas of competency that you will be tested on the NAPLEX, medication safety concepts and pharmacy informatics. So I think it would be appropriate for us to dive into this area today to really focus in on some of the questions that might be asked, but also take a look at how these two areas really cross over. So let's start the little presentation that I have, and we will get into talking about pharmacy informatics focusing on medication safety. So previously we had our definition of pharmacy informatics, and we talked about how we want newer technologies to lead to safer and more effective medication use. So the word safer is there, and that refers to medication safety. There was a report, this is from the year 2000, and it's been widely cited, to err is human. And the main thing I want to take from the screen is that back in 2000, they were finding that there were 19 deaths per day in the United States from medication errors. So it's a real problem we have to deal with. And here's a definition of medication error, and the main words that I want to point out here are, it's a preventable event. So we want to put safeguards in our systems to prevent med errors from happening. And this is especially true of our technologies that we use in pharmacy. You've probably heard of the Swiss cheese model. We have walls, blockades. We have safety measures in place to make sure that errors don't occur. But if everything lines up just properly and an error slips through, we can have an adverse drug event or accident. Another way to look at this, and focusing a little bit more on pharmacy informatics, is that if our technical devices, our information technology, has poor design or poor maintenance, or we haven't trained people properly, or people using our machines or the technologies or the electronic health records are distracted, or they end up with alert fatigue, these are things that can cause the holes to line up and for patient harm to occur. So we want to avoid that preventable harm by making sure that we have the appropriate training, the appropriate barriers, the appropriate use of clinical decision support that minimizes alert fatigue, so that we can make sure to reduce the amount of med errors that are occurring. Institutions will have a separate med safety pharmacist, separate from the pharmacy informaticist, and this person will be in charge of finding, documenting these errors, and then doing root cause analyses to find out how these errors occurred, and putting measures in place so that they never occur again. We also have our failure mode and effects analysis, FMEA, which we can do ahead of time on a technology so that we can pre-identify any errors that might occur that could cause harm, and put measures in place to prevent those from occurring. Now, when we talk about common medication error hazards, we really focus in on look-alike, sound-alike drugs and tall man lettering. We've talked a little bit about this with our database builds and also with clinical decision support. So when we load medications into our automated dispensing cabinets, we want to make sure that things that look alike or sound alike aren't put next to each other, especially in a type of matrix drawer, so that the wrong choice is not made. Tall man lettering, proper database build, when you give the prescriber choices on a screen of what to pick, make sure that those are built properly so that the choices are clear and there is not an error made in a name, a generic or a brand name, or two brand names that sound alike to each other. The Joint Commission is very focused in on patient identification. So when we talk about the 5 rights of medication administration, we always want to have the right patient when we write a prescription or make an order on the inpatient chart. number one, we need to pick the right patient. And this is also true of our technologies, such as using a smart pump or an automated dispensing cabinet. Right patient is really important. See at the bottom here that sources of patient-specific identifiers that have been mentioned are the patient's wristband, which we can scan during barcode medication administration record, electronic health record, MAR, automated dispensing cabinet, removal slips or screens, and then pharmacy-generated labels. You may have seen this before. The mind is incredible with filling in letters and reading words that might be messed up. And they found that in this one study that it's the first and the last letter that's really important, and your mind kind of fills in the rest. And this just points out that when we do our database builds on our systems, we have to be really cautious on how we put those words, those drug names on the screen so that the mind doesn't accidentally pick the wrong thing. With electronic health records and e-prescribing, we've eliminated a lot of these errors that occurred with handwriting, and these are just some examples from the Institute of Safe Medication Practices that show that it's very easy to make mistakes when things are handwritten. So this has kind of been solved with our electronic health records and e-prescribing. You can see when we put things on the shelf or even in a carousel, automated machine, or bulk items that we might place in our automated dispensing cabinets, we really have to be careful on how we place those items into those machines. That includes orals and injectables. Here there's an article going back to 2003 that talks about safety techniques for community pharmacies, and you see even back then they were talking about barcode checking, so using technology to improve safe medication use. If we look at the medication use process, which we've talked about before in the different areas, we see the different technologies that have been applied in these areas, and we've talked about this before: CPOE, e-prescribing, and clinical decision support. Transcribing, we have our EHR, EMR, and CDSS in the transcribing and verification, pharmacist verification process. When we dispense, we have technologies such as automated dispensing cabinets, robotics that make IVs and deliver medications, and then barcode verification. At the bedside, we have barcode medication administration and the use of the medication administration record and smart pumps. And then for monitoring, we do have software that we use for ADE, or adverse drug event surveillance, and also documenting interventions that the pharmacist has done. I talked about the 5 rights. So 5 rights of med administration: right patient, right drug, right dose, right route, and right time. And I want to carry this concept over to some of our technologies. So when we use CPOE and e-prescribing and clinical decision support, we're really using these technologies in conjunction with the 5 rights. So these are technologies that really focus in on getting all of the 5 rights done. Same is true for the transcribing and verification process, where we're using electronic health record and clinical decision support. Pharmacist order verification, we're really focused in on the 5 rights. With automated dispensing cabinet, our focus really is mostly on picking the right patient, getting the right drug into the hand of the nurse that's going to administer that dose. It should be the right dose, and it should be given at the right time. We have prescription kiosks, RX kiosks, where after hours or even during hours, during this time of the pandemic, we want to put our prescription refills or even new prescriptions into a kiosk where somebody can come in and sign in and get that prescription in our outpatient settings. So these are focused in on getting the right prescription to the right patient at the right time. With robotics, we have IV workflow and IV robotics, and those focus on the right patient, the right IV solution, and the right ingredients. So getting the right ingredients into the right solution for the right patient. With barcode medication administration, it's really the 5 rights at the bedside at the time of administration. With our electronic medication administration record, we have the 6 rights, we call it, so the 5 rights plus counting the right documentation of when a med was given as one of the rights. And then with our smart pumps, we focus in on getting the right IV to the right patient and running it at the right rate. With monitoring AD surveillance, we're ensuring that the 5 rights were followed when medications were administered. And with telehealth, which is becoming something that's used more and more nowadays, again with the pandemic, we have a focus on the right patient getting the right care at the right time at the right place. So what we're talking about is really, again, the pharmacists using their knowledge of information systems and the medication use process to improve patient care by ensuring new technologies lead to safer and more effective medication use. This is the statement that I like to use for the definition of what the pharmacy informaticist focuses on. And then what we want to do, the step further for the informatics pharmacist, is to incorporate medication safety principles into all of our existing and future medication use process technologies. So evaluate your current technologies, make sure that you're providing the safest, most effective way of delivering medications. And then as we implement new technologies in the future, as you bring in something new into your pharmacy, make sure that it's implemented properly so that we're ensuring the maximum safety with medication use as possible. With that, I will say if you got something out of this video, if it was helpful for you, please like the video and subscribe to my channel. I'll thank you for that. And in the meantime, I'll start working on the next segment. So our next episode, I will get into some other topics such as data analytics, and then focusing in on more on some of the technologies that we use. So in the meantime, stay safe, stay healthy, look after the health of others, and I'll see you next time. Take care.